Jeremy, the National Academy for State Health Policy is looking at two states, Washington and Colorado, doing a deep dive analysis to understand how much facility fees are driving up cost for all of us. If you remember this mom from our previous reports,
she was like, yes, you pay the doctor's bill. That's correct. But this $847 and some change is the facility fee.
Or this dad.
Once the bill came, we got a $20 bill for the doctor. And then a couple of weeks later, we got a second bill for $503.
Then you remember facility fees are what hospitals charge patients for operating a doctor's office or clinic, not for the doctor's actual diagnosis or treatment. And the facility fee is often way more expensive than the doctor's fee.
Between the provider fee of $375 and the facility fee of $611, we were paying almost $1,000 an hour.
Could you believe that the facilities fee was almost twice what the actual therapist was charging you?
Not at all.
3 different patients who all took their kids to Children's Hospital and paid very different but very expensive facility fees.
Transparency around these additional fees would be extremely helpful.
Maureen Hensley Quinn is the Senior Program Director for the National Academy of State Health Policy.
State health officials that we work with feel like it is inappropriate for these additional fees to be charged.
She says part of the reason facility fees have skyrocketed is because hospitals have bought up private doctor offices. Private doctors don't charge facility fees, but hospitals often do.
We know that consolidation is a driver of overall increasing healthcare costs, and the level in which facility fees play a role in that is what we're trying to understand.
Her study hopes to shine a light and offer model legislation to state lawmakers.
Do you suspect facility fees have become a cash cow for hospitals?
Absolutely.
Cynthia Fisher is the CEO of Patient Rights Advocate, and she's a huge critic of the way hospitals apply facility fees.
They're finding all sorts of different ways to be able to upcode and upcharge and maximize their revenues at the expense of the American worker.
Take Children's Hospital Colorado. It tells the problem solvers the facilities fee for a 60-minute behavioral health visit is $395, but really $256 if you can pay in cash and about $100 if you have insurance. Yet, remember our 3 parents? One mom was charged $611, the dad $503, and this mom $847. When we asked Children's Hospital to explain, we get an answer as fuzzy as most patient bills. As we've shared previously, medical bills from Children's Hospital Colorado are based on the cost, level, length, and type of care that is provided. If a patient meets with multiple Children's Colorado employees or has a more comprehensive assessment during a single visit, the charge will reflect the services provided and be higher. The problem solvers asked the largest hospital groups in the metro what they charge for facility fees. Health One and Centura Health both insist they don't charge facility fees. SCL Health hospitals say they don't charge, though some of its specialty clinics do, usually about $175 after discounts are applied. UC Health tells us its outpatient clinics typically charge $19 for a facility fee if it's related to a 1-hour behavioral health visit. At Denver Health, the facility fee for a behavioral health visit is $184 if you self-pay, usually less if you have insurance.
Blindfolded highway robbery. And that's why these facility fees and every single upcode or any other charge needs to be relayed to the patients in advance of the care. It's our right.
The National Academy of State Health Policy hopes to finish its analysis on facility fees this summer, but it's already recommending states ban facility fees at any doctor's office owned by a hospital if the doctor's office is more than 250 yards from the hospital's campus. Rob Lowe, Fox 31.